Hello, I'm Dr. David Wipperman, and patients often say to me, I've heard you mention standard versus functional blood test results. What's the difference? I explain that we've all had our blood drawn, and generally it's tested at a local lab like Quest Diagnostics or LabCorp. Now these labs all have established normal values for each item that they're testing. For example, a comprehensive blood panel may look for components in your blood like your red blood cells, your white blood cells, your total cholesterol, your iron levels, or even your blood glucose levels. Now, these normal values are established regionally, and it may vary slightly according to where you live in the United States. Now, their numeric values will span a wider range than those of the functional lab results. So, for example, if we were to look at your standard values for your cholesterol in the St. Louis area, it may range anywhere from 100 to 220 to 240. So anywhere from 100 to 220 and even as high as 240. Okay? However, if we were to compare that with the functional values for cholesterol in the same area, it'd be a much smaller range, anywhere from 150 to 200. Somewhere through that area. So, why the difference? Well, your medical doctor is looking to make sure your numbers fall within what's considered the normal or standard range. Now, no matter if your findings are on the higher or the lower end of that range, as long as they are contained in that range, you're considered healthy and you don't have any diseases or pathologies in your body. But that's also why the standard blood test ranges are referred to as a pathological range, meaning that once they fall outside that range, you have a pathology or a disease. And once you have a disease that can be named, it can also be treated with some type of drug or surgical procedure. Now, the reason the functional range is smaller is because functional medicine practitioners want to identify or catch any abnormal findings before they develop into a problem. So if we see you have a tendency for certain blood values to be either on the higher or the lower end of that scale, we look at that as a possible problem developing. And then we may run additional or different tests to rule in or to rule out your problem. Now, the other nice thing about looking at these values differently is that once a health problem is discovered in its early stages, it's much easier to prevent or to correct it since permanent or future damage hasn't occurred yet to the tissues of your body. And oftentimes these problems can be treated in a much safer, more gentle approach by using natural or nutritional approaches like vitamins or minerals or even herbs to help restore your body back before it breaks down. So does it make sense to wait until your numbers fall outside of that range and you have a disease before you do something about it, when maybe your numbers have been borderline for a while and you have the opportunity to prevent or fix it? So why not get yourself checked by a skilled functional medicine practitioner who will look at your results with a different set of standards in mind? If it's discovered that you have health problems, nutritional therapy recommendations and dietary lifestyle changes can be made that will change your life forever.